So good afternoon from Spain. Thank you for the opportunity of sharing our work with you. My name is Maria Viota, and I am talking from the University of the Basque Country at UNESCO Share on Sustainable Development and Environmental Education. I will share with you some results on the contribution of urban green space to city dwellers' health in the Basque Country. This study is included in the project Ecosystem Services Assessment of the Basque Country, which has developed for the Basque Country the conceptual and methodological framework of the UN program Millennium Ecosystem Assessment. The main idea is that decision-making affects ecosystems and their services, and also as a consequence of global change, there are negative impacts on well-being, quality of life, and health. This is very relevant, especially for the urban context. More of half of the population in the planet live in urban settlements, and this tendency is increasing. Cities are also very vulnerable systems, for example, to climate change. So that the study and understanding of ecosystems, their services, and their conservation is essential to promote well-being. In addition, there is a growing body of literature acknowledging green space as salutogenic, as benefiting health. For instance, green space reduce air pollution. They provide also opportunities for physical activity. They may strengthen personal and community ties, and also the presence of green space near home is associated to a better perception of health and a better cognitive development in children when it is near schools. In terms of mortality, people living in areas with a greater amount of green have some lower risk of mortality and also a reduction in the premature death. So all of these have great relevance in terms of public health prevention strategies. Moreover, from a distributive perspective, it has also seen that green space may favor more the most deprived, and inequalities in terms of income may be less pronounced in populations with a greater exposure to green. So there is a need to understand the benefits of urban green space, the potential inequalities in their distribution, and its capacity to reduce these inequalities. In order to develop management tools such as nature-based solutions, for example, for a resilient and inclusive cities. In this study, we explore the relationship between urban green space and mortality and their different socioeconomic contexts to test for the contribution of urban green space to health. As I said, the study was conducted in the Basque Country, which is an autonomous community in North Spain, which covers a surface of more than 7,000 square kilometers and hosts a population of more than 2 million people, with 3 metropolitan areas very densely populated. We retrieved the data from official public sources and we selected for the health indicators the relative risk of mortality of 14 diseases. And the exposure to green space was estimated by NDVI. As socioeconomic contexts are shown to have influence on health, we took them into account by means of the 5 that are defined by an official deprivation index. We ran multivariate analysis, principal component analysis, and we selected the final indicators. We retained, finally, relative mortality risk of lung disease and also the proportion of NDVI to be tested afterwards with these deprivation groups. First of all, we wanted to explore the relationship between mortality and green space, and we found an inverse correlation. So the greener the area, the lower the mortality, the greener, the better. We also wanted to check for the relationship between mortality and deprivation, and we found that for men, this mortality increased as deprivation did. So the most vulnerable people were showing higher rates of mortality, but it was the opposite pattern for women. But very interestingly, for both men and women, the greater exposure to green space, the lower the lung mortality risk. So it may be indicating that there is a positive effect of the green areas in the city, and that these benefits could be increased by increasing the exposure to greenness, or at least to a threshold to achieve so. It is also interesting that for men, the most vulnerable group, may benefit more because the decrease was higher, but and for women, as greenness exposure increased, the steepness of the gradient showing income-related differences was also smooth. So with these results, we aimed at highlighting the potential salutogenic processes mediated by green space and the key role of green availability and distribution in terms of public welfare, including an equity lens for the most vulnerable. In terms of social justice, the negative environmental impacts usually fall more on the most vulnerable who have less responsibility. Health is determined in part by lifestyles, let's say freely chosen by people, but there is a great influence of the socioeconomic context with these choices. So the reduction of inequalities could come from interventions improving access to healthy choices, for example, green spaces, since this area can modify the mechanisms people with a lower socioeconomic conditions are related to diseases. So we think it should be considered by urban planners to design interventions increasing green, to offer opportunities to create more livable, sustainable and resilient cities. And for cities, these urban green spaces, urban green infrastructure integrates very well into elements of the urban landscape, such as urban parks, green walls of roofs, and provides an interesting tool for a just and inclusive urban planning. Thank you very much.
Great, thank you, Maria.
Thank you.
We've got some questions coming in, and folks, we do have just a little bit of extra time. Don't forget to add your questions here. For your first question, what motivated you to look at the relationship between green space and the incidence of lung cancer?
Yes. At the beginning, thank you for the question. It's very good. At the beginning, we were trying to explore the relationship between mortality and green space, and we found many different variables, and we started to explore the behavior of these variables in comparison to green space, and they were quite inconsistent. We detected some kind of inconsistency between them, so we decided to add all of them in a principal component analysis, and the lung cancer relative mortality risk was the variable that showed a greater relationship in comparison to green space. So that was the reason we just filtered.
Great, thank you. Another question for you is, how do you think an ecosystem services framework can inform sustainable urban planning?
Thank you very much for the question. For example, with this kind of studies that they translate the ecosystem services approach to data related to mortality of people. So these ideas of ecosystem services, I really like them because they can they allow us to offer the planners data on green space, and this is the following steps I would like to carry out. Because this is the connection between the idea of ecosystem services and the application to for example, urban planning.
Great, great. Thank you. And can you comment, what do you think, which ecosystem services are probably of greatest value in the urban environment?
Well, this is a really good question, and I'm not sure, but I think it is related to air quality, and also it is maybe dealing with these recreational values that these green areas offer in the city opportunities to do physical exercise, which of course it is very in line with health, both mental and physical health.
Great. Maria, can you just tell us what's your next priority in research?
Thank you. Yes. Okay, I would like to continue analyzing this data, and the idea is to explore the quantity of green needed to decrease mortality, or the theoretical quantity that offers a threshold, let's say a threshold in mortality rates. And also I am very interested in cultural services and related to mental health, because in cities, cities displays a variety of issues related to health. So for me, mental health and this enjoyment of nature in the city is very appealing.
Mm-hmm. Great. Maria, thank you so much for sharing your work with us.